About 200,000 people die of malaria every year in Nigeria. That's according to the World Health Organization. That's about 31% of global malaria deaths. The country has the highest number of deaths caused by the disease in the world. Nigeria is one of 4 African countries that account for just over half of all malaria-related deaths globally, according to the WHO. And as the world marks this year's World Malaria Day, health experts are urging the Nigerian government to do more to prevent the spread of malaria. Our correspondent Tessa Makende has more from Jos.
Enoch Godfrey is getting treatment for malaria. It's the second time in the last 5 months.
I'm very weak and I'm loss of appetite. This year, actually, this is the first time malaria attacked me, but normally malaria do attack me twice a year. So I've been finding a way to keep myself from malaria, and especially this period we are, this is when mosquitoes are everywhere, the rainy season period.
Malaria is a disease caused by a parasite and spreads to humans through the bites of infected mosquitoes. According to the Malaria Journal, Nigeria has the world's biggest malaria burden, with approximately 51 million cases and 207,000 deaths annually.
When you look at our environment, it's one that favors the growth of the vector that causes malaria, which is the Anopheles mosquito. You look at the regions, we have a lot of areas that are waterlogged. We have a lot of vegetations that trap water, and you know that make the egg of the vector, survive. And then Nigeria has a huge population. So when a disease occurs in this area, of course, it's going to affect a large number of people. So we have that number again. And then also the level of education concerning the prevention is not, we need to do more.
Nigeria and 3 other African countries accounted for over half of all global malaria deaths last year. 31% of the deaths, amounting to 191,890, occurred in Nigeria, 13% in the Democratic Republic of Congo, while Niger Republic and Tanzania trailed behind with 4% each. Medical experts in Nigeria are calling on citizens to ensure clean surroundings, and they are also asking for improved government funding to address the situation.
We need to make policies that will ensure that people don't come down with malaria. We need to make policies that will make the environment unfavorable for this vector. We need to make policies that will say, okay, vaccine, where we insecticide a whole large area and make sure that this vector is not there. Our health education concerning malaria and its preventive methods should really go down to the grassroots and then everywhere, and then ensure that the treatment of malaria is made readily available and also, if possible, free.
The government says it is taking steps to fight malaria. It has granted provisional approval to Oxford University's R21 malaria vaccine for the prevention of the disease in children from 5 to 36 months of age. It's the second country to do so after Ghana. More than 8 million insecticide-treated nets to prevent malaria have also been distributed to households in the country. That should protect more Nigerians like Enoch Godfrey against malaria, and also reduce the number of deaths associated with the disease in the country. Tessa Makende, CGTN Jos.
So let's look at these statistics further and generally the situation as a whole, especially in the African continent. And we're joined by Dr. Damaris Matoke Mohia, Acting Deputy Director of the Biotechnology Research Program at the Kenya Medical Research Institute. She's joining us from Kisii in Western Kenya. Thank you very much, Dr. Mohia, for joining us. So as we mark the World Malaria Day today, what is the current malaria situation on the continent?
Thanks for having me. The current malaria situation in our continent now stands at us having about 247 million cases based on the World Health Malaria Report. And also we've had around 619,000 deaths from the disease. African continent stands at 95% of these cases and also 96% of the deaths. So Africa carries the highest burden of the disease.
And it's a fact that malaria kills an African child every 60 seconds. I mean, that's huge. Are there plans for a malaria-free Africa, and what will need to be done for that to happen?
Yes, there are plans to have a malaria-free Africa. One of the things is trying to address what are those gaps, what is contributing to increased malaria incidences in the African continent. So we are working towards ensuring that every child, based on the vaccinations that have come on board, is vaccinated to start with, and also to ensure that every adult is able to sleep under bed nets, because this is the way to control from mosquito bites, and also to ensure that breeding sites where the mosquitoes are sprayed with larvicides, doing what we call as larvicidal management. Our vision as a continent is a zero malaria, or a zero malaria continent, and also an Africa free of malaria.